So hi everyone, today we will speak regarding the letter A or the M.A.R.C.H algorithm. So A, you know, as it for airways. When we are speaking regarding the airways, we need to first secure the patient's consciousness to understand at least. For this reason, we are using AVPU system. AVPU system is a kind of simplicity form of the Glasgow scale that always we are using to understand the state of consciousness. So here we have 4 letters. A is for alert, is the best variant of consciousness. V is verbal, when the patient is responsive but only for your commands. P is for pain, when the patient only responds to pain indicator. And of course, U on consciousness, it means that your patient is not answering well. How I need to choose it? At first, to check the patient, is he alert? I need just to speak with him. So, what's your name? How do you do? He's not answering. So you need to ask few 1 or 2 questions that will be easy, and they need the ask injured person to tell you something. If you haven't got a mark, you need to go for the next question. So for V, please take my 2 fingers, as an example, take my 2 fingers and tie them firmly. If he's not performing it, so it's not the letter V. Then I will check his pain zones to understand if he reacts on it or not. How will do it? There is a pain zone here in the chest. We can open his uniform and press on that zone. And we are taking a look at his eyes. If he's responding, okay, it's P. If not, we are also checking the second pain zone. If that zone answer, okay, well, it's P. If not, we are going to the last letter, and the last letter is U on consciousness. The patient is not responsive. So A, V, P, U. Why I told you in the beginning before we are going to airway situation. So you need to know that A, V, P, U, A, mostly we will not provide any actions to our patient. So his airways are secure because he's talking. If he's talking, it means that breath comes in and air comes out. Regarding the VPU stages, if we have this kind of patient, we need to provide some additional maneuvers. Regarding these maneuvers, a little bit later. At first, what do you need to do? You need to check, are there any foreign objects in his mouth? How you can perform it? With one hand, I'm putting on his head. With another hand, I open his mouth, and I'm taking a look inside. What I will see? If the object is behind his teeth line, it means I will not evacuate it because it could cause several problems later. If it lies before, anterior, I will remove it. How will I remove it? I pull his back here and evacuate it and improve downstairs. So that's the first point. After I understood that his airways are checked and there are no foreign objects inside, I need to calculate his breath movements. How will I perform it? There are several procedures, but I will perform the easiest one. I'm pressing on his head. I'm opening his mouth with one hand. I'm attaching my ear to his mouth, not so close, and I'm putting my hand on his chest. I need to listen. There are a few variants. I can check for 10 or 15 seconds, so for me it will be more comfortable. And I will multiply results of 10 seconds, of course, to 6. Or 15 seconds to 4, because I need to understand the result in a minute. So I'm calculating his breathing movements. What is the breathing movement? It's inhalation and exhalation. Together, they form one breathing movement. So I will calculate it. I'm taking a look. I'm hearing his whispering sounds. And I'm calculating the time. For example, I can use my free hand to calculate one breath movement, then second one, third one. So it could be easy for you to not miss between time and his breathing movements. So regarding the criteria, 0 and 1, it means the patient has some troubles with breathing. In this case, I will need to inform my next level doctor to give me some additional assistance. If my patient breathes 2 or more, it means this patient breathes normally, and our help on this level is finished. Thank you very much.